Hi, it's Dr. Hizon, and we're here to talk about attempting to get a clean billing claim, because a clean billing claim is the goal, just like this mountain. So we're going to be talking about some coding and billing items that are important if you're a medical scribe or a medical informatics specialist. So there is something called the International Classification of Diseases in the 10th revision called ICD-10. And these are the codes you would use for diagnosis. I want to go through some of the pearls and pitfalls of this as a medical informatics specialist. So understand there needs to be an alignment of the chart note. The chief complaint has to match and lead into the history of the present illness, into the objective findings on the physical exam, into the medical decision making, into the diagnosis, and into the actual plan and treatment. So different electronic health records have different super bills. This is one of the ones that we use, and you can see that we have to put in the ICD-10 codes. This is for type 2 diabetes. So the order of the diagnosis you put down on a super bill is very important, and it's going to be a stepwise type of thing, with the first one being why the person was seen. So there is a bit of a difference between the chart note and the super bill. The chart note should list all the pertinent diagnoses, but depending on the electronic health records you use, the insurance super bill may only list the top diagnosis. Sometimes that's only 4, but many of them have expanded now to 12. So it starts with the chief complaint. You need to have the symptoms and you need to have the durations in the chief complaint. And they really should be in the patient's own words, such as, I can't see things on the left, as opposed to medical jargon like bilateral hemianopsia. So use the patient's words if you can. And then when you get to the super bill, the first diagnosis must be the reason for the visit. So we're using ICD-10 codes, and there's different types of them. I really like the R and the M codes. I think of them as my friend, just like Lassie was my friend back when I was a child on TV. And then you also want to look at the body part, and you have to make sure you get the left and the right of the patient correct. So our codes are symptom codes. A lot of times when we see a patient, we're not exactly sure of the diagnosis, but we can code the symptoms, such as fever, runny nose, cough, sore throat, and our codes are very good. M codes are more for musculoskeletal type things, as opposed to actual diagnosis. You can, with the M code, it comes into being more precise. So R codes are for symptoms, M codes are for musculoskeletal. And then with any of these types of things, especially with the injuries, you need a place of occurrence code as well as an activity code. So for example, these goofy people that are putting electricity in the water doesn't look good. The pool is the place and the activity is the swimming. And then S codes are pretty challenging to use, and you should never have them in the first position on your diagnosis. Just like you should never tug on Superman's cape, consider not putting an S code in the first position. S codes are a challenge because there's an initial exam of the S code, subsequent exam, and sequela. So these get to be a bit of a challenge, and I wouldn't do these at the beginning. For the physical exam on the objective, if you're complaining of, say, a right knee, you must obviously document the right knee exam. At the same time, you want to look at the joint above and below. So for the knee, you look at the hip as well as the ankle, and you should look at the contralateral or the other knee for this. And then understand that we have what's called HEDIS, or quality measures. And a lot of times, these also have to be met. And these are some other codes that we look at for requirements for quality measures. For annual wellness exams, we'll use Z codes, and the first code, if there's an abnormal finding, it would be a Z00.01. If the patient is perfectly healthy, then it's a Z00.00. Most of the time, it's the 01. And then on the annual wellness visits through Medicare, these are special codes that must be done, and usually these are G codes. And for diabetics, they have multiple different kinds, and you have to be sure you know if it's a type 1 diabetic or type 2 diabetic, as well as do they have kidney, eye, or any sort of ulcerations, those will all change the code you use. And then there are areas in certain electronic health records where you have to put the screening codes in there. So there's quite a few different codes. And then when someone does not have a diagnosis anymore, you can stop that diagnosis in the electronic health records. So in summary, it's a big challenge to get the diagnostic ICD-10 codes correct. I think of R and M codes as our friend. When in doubt about the coding, ask your doctor, and then really be sure that you get the gender and the laterality correct. That means you get, is it male or female, and is it right or left. You'd be surprised how often this is a challenge, because these mistakes are essentially unforgivable in court. So in summary, please continue to work hard to get the coding right, because a clean chart equals a clean claim. Thank you.